Hi everyone, I'm Dr. Traci Moreno, psychologist, and I'm going to tell you a little bit of my background, my CV, just so you have my qualifications for why I'm doing these videos in the first place. So I graduated with my doctorate in 2006 and I got licensed in 2008. That was, of course, after you graduate, you also have to do your postdoc hours and take the EPPP, which is a nightmare to study for. But I'll talk about that in a later episode. And then you also have to take a state exam. So it can take, at least a year, if not 2 years, which is typical before you graduate, before actually getting your licensed. So my first job, I did graduate as a clinical and forensic psychologist. My first job was at a maximum security prison. And I was a psychologist there and eventually became a supervisor, and I worked in administrative segregation, which, for those of you who are not familiar with that, is basically the prison within a prison. So when somebody gets in trouble within the prison, they are sent to administrative segregation, also known as ADSEG. So lots of fun, basically training by fire. Got right into the thick of things, and it was pretty crazy but pretty awesome. My next job was at a community clinic, and that was great. I was the director of mental health services there for about 8 years, I think. And yeah, that was a wonderful experience. And then from there, I opened my own private practice. So, and that's where I am now. So where I am right now is my home private practice. So this is my house, and actually this, where I'm sitting right now, is my office. So I'll give you a little kind of tour around, because we have about a 2-acre property. It's called Free Spirit Coaching and Psychological Services. We also do alternative treatment options, such as equine assisted coaching, spiritual coaching, crystal Reiki healing, sound healing, yoga, hypnotherapy, just any kind of different type of things. But I personally do traditional psychotherapy. Those are our therapy dogs in the background. But I do traditional psychotherapy, CBT, motivational interviewing, EMDR. I do a little EFT tapping. Those are probably the main ones. And of course, spiritual psychology. My private practice is a spiritually based practice right now, but believe me, this is not how I started my career. So I'll just give you a little kind of tour. I'm going to turn the camera around. So this is our property, and we see clients outside as much as possible. Luckily, we are in Arizona, where we have gorgeous weather most of the year, so we're very lucky about that. And this here is my outdoor office. And we also have, I don't know if you can see her back there, but we have a little mini donkey named Faith, and we use her for equine coaching. And we have some offices on the property where I have contractors that have indoor offices, and then we have a little gazebo over there which serves as another outdoor office. So this is what I have basically graduated to, but this took probably a little over 10 years to get to this point in my life. So those are my credentials, in case you're interested. And the reason I want to do these training videos is because in my experience as in management and interviewing people, it became very apparent very quickly to me that most therapists don't have the knowledge and the skills they need, or even the terminology, even kind of basic terminology that they need to actually work in the field. what is taught in school is great and it is needed, but it doesn't translate very well to, to actually being on the job and being a therapist. So the goal of these videos is to talk about what is actually needed and how to do therapy and how to start this. So hopefully this is helpful to everybody. I would love any topic suggestions, questions, comments. If you ever have anything to add about things, anything that I missed, there's not going to be any fancy words up on the screen, and so take notes. I'll do the best I can, but I'm just going to be talking off the cuff. This is not my full-time job, so I really just wanted to do this to help out. And I've also heard very almost nightmare experiences from other therapists, but that started working in the field, but also even worse from a lot of clients who participated in therapy, at least once before. And it's disheartening because most people don't come back. They'll have one bad therapy session and that's it for them. And, we want to avoid that. And so I really want to just take everything that I've learned, even little tricks that can help you out, and, how to just keep making progress with people and developing rapport and that trust, and using these interventions in such a personal, realistic way, I think is just so valuable and important. And we want to, the goal is really just to provide a safe place for people, our coworkers, other therapists, and the clients. So that's my goal of all of this. And so I'm going to really be focusing on things that you're not going to hear in school. So anyway, I hope that helps. Talk to you soon. Bye.